Hello everybody, this is Colin Talbot again, talking to colleagues around the world on how their governments are responding to the COVID crisis. And today I'm joined by Zafer SAHIN and Mete YILDIZ from Turkey. And we're going to discuss what's been happening there. And there's been some interesting issues, I think, arising from the reaction to the crisis in Turkey. So I'm going to start just by asking you both to introduce yourselves. Mete, would you like to go first?
Sure. My name is Mete YILDIZ. I'm a professor of public administration and policy at Hacettepe University, which is located in Ankara, Turkey. And my fields of specializations are e-government, technology used in public administration and policy, public policy issues, and government reform. And thanks for the invitation again.
It's great to have you.
Hello, Colin, again.
Hi, Zafer.
I'm Zafer SAHIN. I'm a professor of local governments and city planning in the University of Hacı Bayram Veli in Ankara again. I'm located in Ankara as well. My specialization areas especially are urban planning, urban management, local governments, and especially metropolitan governance. And thank you again for accepting us.
No, that's great. And it's good to have a combination of you looking at national and local governments, because I think there are some issues in Turkey about the relationship between central government and local government, but we'll get on to that. Could you just, one or both of you, say something about the degree of the problem in Turkey? My reading is that, although it's nothing like as large as it is in the UK yet, you are having quite a large acceleration in the infection rate, the last news bulletin that I looked at.
According to, if I may start, according to Johns Hopkins University statistics, as of April 19th, Turkey has 86,000 cases. We are just below United Kingdom in that regard. Around 2,000 dead, which is quite a low percentage when you compare it to other countries. And around 12,000 people are recovered. So when you compare Turkey to big countries such as Turkey, which hosts 83 million population, such as Germany and Iran, we are not doing extremely good, but not extremely bad at the same time as well.
Okay. Can I just ask about the infection rates? Because one of the questions here is that testing has been so limited, mainly to people in hospital until very recently, that the numbers tested and the numbers identified as being definitely infected with COVID, I think are a massive underestimation in the UK. So I read something that the testing in Turkey was also relatively limited, although not quite as limited as ours.
Maybe I can contribute to Mete in this subject. It's been a controversial debate in Turkey as well from the start of the pandemic in Turkey till today, that the government is not doing necessary number of tests to the subjects. Yet there is a clear policy of the Ministry of Health based on, then there is a scientific committee in which the ministry based its policies on, and members of that scientific committee, which are from medical science, public health, and other infection disease specialists, they're telling that they have an algorithm to increase the number of tests to a necessary level, because they don't want healthy people to rush to hospitals and put their lives in danger and causing the pandemic to spread. So they say they have an algorithm. So from start to today, there's a gradual increase in the numbers of tests, and it's nowadays it's like 40,000 tests per day. And among those 40,000 tests, they catch like the 10% the infected people. So I can say that.
Let me
Other,
add a couple of things to the testing issue.
yep.
As of April 19th, 634,000 tests are being administered, and as I mentioned, identified 86,000 infected. This is less than 1% of the total population of Turkey, which is 83 million. But I concur with Zafer that this is done due to the incremental implementation strategy of the government. They don't want to overburden the hospital system, which is quite strong, I should say. Let me give some figures about the human resources in the health area as well. These are 2016 figures. Turkey has 145,000 doctors, 153,000 nurses, and 200,000 support personnel. And finally, we have 40,000 intensive care units in total in the country.
Right. Could I just check on the testing? Is the testing, because the testing in the UK has been limited to people in hospital. Very early on it was wider than that, but since then it's just been people in hospital. Now they're expanding it out of the hospital settings. Has something similar happened in Turkey, or has it been more community testing?
There's more like an incremental process, and in that incremental process, there is widespread information given to the citizens, and telling them to check first the symptoms. If a couple of symptoms are detected, they've been directed to the neighborhood doctor. And when the neighborhood doctor checks the patient and suspects that there is a possibility that that person is a diseased person, he directs that person to the nearest hospital possible where there is a testing facilities at work. And in that testing, they first, if they first detect positive for the testing, they devise a home lockdown for that person, and that neighborhood doctor follows him, her daily with telephone and other communication issues. If the person goes worse, and then he's been transferred to first a hospital and then intensive care unit. So there's a progressive algorithm working there. And recently they introduced also a mobile application to follow and inform the general population of the infected people.
Okay, that's great. Thank you. Can we just turn briefly to, just for people who are not familiar with the structure of Turkish government, to say something briefly about the relationship between central and local government and the type of health service you've got and so on? That would be really useful, I think.
In Turkey, there's a recent transition from the parliamentary system to presidential system. It's still an issue that we are working on. We have a centralized administrative system, a unitary state. As I mentioned, 83 million people, plus 3 to 4 million, mostly Syrian refugees, and located in 81 provinces. So this is a quite centralized system. There is as Zafer will mention in a minute, there is more like a competition more than cooperation between the national and local governments due to political rivalries. And the objective, the strategy of the government so far seems to be minimizing or delaying infections, minimizing deaths, while keeping the economic wheels turning. So that's one of the reasons that we are doing not many tests as well.
Okay. Zafer, did you
I
want
may
to come
add
in?
to this. I want to add this the situation about the local governments. We might say that Turkey is now a two-tier system, actually. On top, there is the presidential executive body, which is a new instrument of government we are testing. And on below, there are 30 metropolitan municipalities with huge authority over provinces. And giving services to 75% of the whole population. So generally the competition is between the presidential body and the metropolitan governments, because quite recently, actually 1 year ago, there has been a local government election, and 11 of very important of those metropolitan municipalities were won by the opposition. So just after that transition, the prominent cities like Istanbul, Ankara, and Izmir are at the hands of opposition, but the presidential body is at the hand of the ruling party. So there is a political competition among them. But I believe that competition might sound bad, but we're seeing that both the local government and the central government are trying their best to find innovative and ingenious ways to, reach people, which is not quite bad on the other side. Politically,
Okay.
it's annoying, okay, but everybody is trying to get you one mask or deliver you bread or something like that, which is not bad for an ordinary citizen, I might say.
No, good. One thing I did read was that there was some dispute between the local authorities. I particularly read that the mayor of Istanbul had been calling for a full lockdown, similar to what we've done here, but the central government is only imposing that at weekends and for certain age groups. I wonder if you could say something about that, and has things changed since I read that?
Actually, Istanbul's position is quite peculiar, because nearly half, maybe more than half of the cases are in Istanbul. So for Turkey, it's might be called as a pandemic for Istanbul. So in Ankara, where Mete and I live, and in other cities, of course, there are cases, hundreds of cases. But Istanbul is a very crowded, very dense, cosmopolitan city. So that's why maybe the mayor called for a complete lockdown. But on the other hand, city of Istanbul is the economic and social heart of Turkey. If you stop life there, probably the whole Turkey will be affected, as if the whole country has been in lockdown. So it's a very controversial and difficult decision, I believe.
Yeah.
I agree with Zafer on that, and Turkey is caught during an economic crisis. So the government understandably would like to keep the economic wheels turning. A complete lockdown would hurt the economy in the middle and the long run. But instead of that total curfew, there were some lockdowns in metropolitan cities, 31 of them, which constitute 63 million out of 83 million, which is quite a lot. And there are some curfews for the elderly, chronically ill, and people under 20 as well.
Right. Okay. That's interesting. I just wanted to pick up on something you mentioned earlier, which is about the Syrian refugees, because most of those, I think, are living in camps along the borders. And I just wondered how much that must be presenting the government with a huge challenge.
In fact, most of the refugees, unfortunately, are not living in the camps. They are scattered throughout the country in small, medium, and especially big cities. And they have been using the Turkish health system quite a lot even before the pandemic. Right now, all the numbers we are sharing are including Syrian and other refugees. And as Turkish citizens are not paying anything for either diagnosis or treatment, neither do they.
Right. Okay, I hadn't understood that. That's interesting to know. Presumably that must be impacting hugely on local governments, Zafer.
Definitely. Actually, maybe the perception of this about the Syrian refugees in Turkey is based on just the events before the pandemic, because there are some clashes in the Syrian border of Turkey among the regime and the Turkish army. So some Syrian refugees fled to the borders of the Greece and tried to pass the borders, giving the impression that most of them are like that, but actually most of them are still living in large cities. But actually, it's you're right, it's a burden among the local governments because especially the low-educated, poor Syrian refugees are doing jobs like collecting recycling material, collecting garbages, things like that. So they are walking around the city, might be distributing the disease. Some municipalities banned them to collect garbage and provided them food so that they do not travel around the city, like the Ankara municipality where we live in. So it's a burden that the local governments are doing as best as they could, seems like.
If I may add, Colin, something about the Syrian refugees, ironically, they helped the Turkish health system to build more capacity because the Turkish health system was dealing with the long eradicated illnesses brought from Syria by the refugees, and including that with the current frequent earthquakes and the avian flu pandemic responses, I would say all those helped the Turkish health system to be better prepared.
Yeah, I was going to pick up on that issue because from some of the previous interviews we've done, it's been clear that a number of East Asian countries, because of SARS and MERS, had been very well prepared for this pandemic, whereas a lot of Western countries, including my own, have been very ill prepared for it, even though there were lots of discussions. And Turkey sort of is in the middle between Europe and Asia. And I just wondered, you know, how well prepared the government was and the health system was for a crisis like this.
We had some extra time to prepare and examine the responses and the development of pandemic in places like China and Italy. For example, the ICU units, Turkey realized that we had to have more ICU units. There was a transformation before the pandemic. Turkey has been building city hospitals, big hospitals in one or two places in the city and closing the other scattered hospitals throughout the cities. We are now using some of those hospitals as pandemic hospitals. And regarding your earlier question, we have declared all public and private hospitals in Turkey as pandemic hospitals as well.
Oh, okay.
And I might add to that, thinking about the pandemic and what it necessitates, seems like the pre-pandemic periods, economic understanding, meaning that high-tech production and high-tech capacity might not mean much useful in pandemic period. And looks like the countries like Turkey, which has somehow low-level technology industries like textile industries, were useful in providing like masks and producing lots of other things. So that's Turkey is now sending support to lots of countries, and people are asking that how Turkey do that. Turkey is doing that because it's producing it. Basically, it's a very basic thing. We were producing billions of them, but nobody, maybe not nobody, but most of the people does not pay much. So we were not getting earn lots of money from that. But now it's valuable now. So it's not a problem. The problem in Turkey itself is a problem of distribution. The government declared that it will send masks and other necessary materials to whomsoever applies through internet, but the distribution is a problem because they do not want to do that via the local governments. They want to do it by themselves, the central government, but It's not an easy task. So there are the masks, but distribution is a problem. So we can send those masks to Britain or wherever it is needed.
If I may add, sorry.
Can I just say we're waiting for a big shipment to arrive from Turkey at the moment.
We will send one bag of masks, Colin, with Mete and I.
Thank you.
If I may add a couple of things to international aid question. Of course, it has an international relations touch, a soft power touch to it, but I see it as a symbolic gesture about international solidarity and cooperation within NATO and Turkey's intention to be still after Brexit, still to be a member of the European Union, our intention holds. But we haven't sent masks and stuff only to Great Britain, but also to countries like Italy, Spain, Palestine, and Israel as well.
That's really interesting, because that certainly hadn't come across here.
Yeah.
Okay, I think we're coming towards the end. I just wanted to see if there's anything you think we haven't covered yet. I mean, I would say, I suspect we're going to come back and have this discussion again in a few weeks' time, because this is not going to be over anytime soon. Zafer, was there anything you wanted to add?
Actually, as a city planner, I believe we might have to discuss the structure of our cities and the logistical framework, how the production and services are distributed throughout our cities during these pandemics. There's something we learned in Turkish cities which might be helpful in evaluating policies in other countries, that in terms of distribution of services, the traditional parts of the city and traditional methods are working better than the newer large-scale methods. Like you might have a large shopping mall with very big supermarket, but you have to close it. So you need to turn back to your local grocery and local store, which is, you know, which were trying to survive under these harsh economic conditions. So that is, I believe, what we learned in Turkish cities, that we might be looking back into our traditional city structures, and there will be a policy resurgence on that issue for looking into the city planning perspective.
Can I just, on that, before I ask Mete to come in, I think that's really interesting, because at the beginning of the crisis here, there was a rush on the big supermarkets to buy stuff for people to stock up in terms of the lockdown and so on. What was interesting, though, was that there were widespread reports that a lot of the small shops, the small distribution networks, were fine. They had plenty of stocks, but the supermarkets were getting cleared out. So I take your point, and I think there's going to be some interesting discussions about that in this country as well before this is over.
Definitely.
Mete, did you want to add anything before we close for this session?
Yes, just two things. First, thanks for this opportunity. The first thing I would like to add is the demographic issues that we haven't discussed much. Turkey has, according to official statistics, only 8% elderly population, which is around 7 million people. Compared to UK, it's 18%. This is World Bank data, 2018. And Japan, 28%. And Italy 3%. So this may make a difference, especially in deaths, I guess. And second thing is, we are trying to imagine what kind of world there will be when we wake up from COVID-19 pandemic or bad dream, I guess, both personally and government-wise as well. Something that we are going to discuss more, I guess, regarding governmental organization is the introduction of a universal basic income for people. Those discussions are making me very excited, and I'm hoping to see what is next after this. Thank you again.
Thank you both for joining me. And as I said, I'm sure we'll be talking again in the not too distant future. Thanks very much.
That would be great.
Thank you very much.